Thank you. Good afternoon, everyone. Welcome to all our audience, wherever you are. My name is James Watt. I'm sitting in London, and I've had the task of chairing this webinar. And we have four excellent panelists. I'd just like to briefly introduce them before we then move over to asking them to speak. The first is Dr. Walid Marush, who was appointed Assistant Dean of Graduate Studies and Research in January 2019 at LAU. He's an Associate Professor of Economics and served as Associate Chair of the Department of Economics at the Adnan Kassar School of Business between 2012 and 2019. We also have Dr. Ali Fakih, who is Associate Professor and the Associate Chair of the Department of Economics at the Lebanese American University. He is also a Fellow at the Economic Research Forum, the Institute of Labor Economics, the Center for Interdisciplinary Research and Analysis of Organizations, and the Global Labor Organization. We also have Firas Abiad, a distinguished surgeon who simply describes himself as manager and CEO of the Rafiq Hariri University Hospital in Lebanon. And finally, and not least, we have Fouad, Dr. Fouad, who is Associate Professor of Public Health Practice at the Faculty of Health and Sciences at the American University of Beirut, and co-director of the Refugee Health Program at the Global Health Institute there. So four very distinguished panelists. I'm absolutely delighted to have you, and we're going to launch into that. Before we do, could I just say that this webinar is being recorded and will be played publicly afterwards. So all of you should bear that in mind. And also to say we very much welcome your participation, your questions. And could you please do that using the chat function? And that will be picked up and collated by our colleague Adam Coutts, who will then feed those questions to me in the chair. I hope all that is clear, and I'd now like to start our session, just 10 minutes each speaker, and ask Dr. Walid Marush if he could open the webinar. Thank you.
Thank you, James, very much. Thank you, everyone, for your attendance, and dear friends and colleagues. I just want to briefly talk about the economic situation in Lebanon as of today. So, as you know, the crisis that started in the late teens and was clearly underway by fall, summer 2019, is now considered to be the worst economic crisis in the history of modern Lebanon since modern Lebanon, or Le Grand Liban, was established in 1920. And the reason for that is that it's a triple crisis. So at no point in time in the history of modern Lebanon, we had a banking, a currency, and an economic crisis at the same time. So while it's true that during the Lebanese Civil War between 1975 and 1990, we had the currency crisis, especially in the 1980s. We also had economic crisis, but still in the 1980s, during the deep currency crisis, banks were still solid and were still functional, Lebanese banks. But today, the banking system is dysfunctional. We have a currency devaluation, and we have a deep economic depression, and this is unprecedented. And this is causing lots of misery, as you know, and the future of the Lebanese economy is really looking very bleak. Another observation is that the collapse was very fast. So Lebanon dropped from middle income status, according to the World Bank classification in 2019, to now lower middle income. And if we, along these trends, we're going to be ranked in the low income countries. And usually such economic destruction is not seen during peacetime. We observe such economic destruction in warfare, but this is not the case. So the best way to describe the Lebanese situation now is that we're living in a war zone condition, economic condition, but without bullets and shells. Another feature of the crisis we're living in is that the US dollar, as you know, since the end of the Civil War, the Lebanese pound was pegged to the US dollar, And since fall 2019, it's no longer, or it's theoretically pegged, but it's no longer traded freely at the banks. And this has created a black market for banknotes. And as you well know, in the 21st century, economies that use banknotes or are cash-based economies, as we call them, are poor economies. So usually in the 21st century, the heavy use of cash is not associated with prosperity. It's rather associated with illicit activities, with drug trafficking, smuggling, prostitution, whatever you want to call it. But any modern economy in the 21st century that relies only on cash is definitely a poor economy. And pushing the economy into cash, there's simply not enough banknotes in the economic system to sustain all economic activities. And therefore, the economy has to shrink accordingly, so shrink in size accordingly. Another thing is that feature of this crisis is that subsidies have been enacted, or maybe calling them subsidies is not very accurate, but let's call them subsidies, as Banque de Liban, the central bank, likes to call them, for fuel, for medication. So these subsidies were enacted since the dollar became non-tradable at the banks in fall 2019, and the central bank has been slowly removing them. But at the same time, the Lebanese government has not lifted the price ceilings on gasoline and on medication, nor on electricity. And this is causing black markets and shortages. This is basic economics 101. We know whenever the government imposes price ceilings on goods and services, we have black markets. And usually in black markets, we have shortages, we have misery, and the profits goes to the pocket of the smugglers. No one benefits basically from subsidies. The only ones who benefit from subsidies are the black marketeers and the smugglers. It has been long discussed that it would have been much better to spend these precious dollars on direct aid transfers to poor households rather than spending them on silly subsidies that are actually making the problem even worse. Another feature of the crisis is the poor and mediocre economic thinking among the Lebanese makers in general. So the rulers of Lebanon, if you look at them now, they are not only financially bankrupt, they are also morally bankrupt. They are intellectually bankrupt. They have nothing new to offer to us. They are not able to propose any meaningful solutions. Moreover, all the system that has been organized around a big public sector where you have nepotism, where you have appointment by militiamen and all these issues starting in the 1980s and growing with the public debt that was mainly used to finance hiring in the public sector, and also resources being wasted, for example, on electricity without finding any solution, any long-term solution. So this business model, this economic model that the rulers of Lebanon have been setting up since the end of the civil war is now totally destroyed and cannot be easily replaced by these politicians. And another thing of this feature is that we always notice special interest at work in governance in Lebanon, but since the crisis started, we have really seen it in a very glaring way, if you want, especially with the cartel of fuel importers, with the cartel of medication importers, and cartel of bread makers, all kinds of cartels. You find them always begging for government support, government subsidies. We all know that all these so-called subsidies will not benefit the Lebanese people. They will rather only benefit special interests. Especially these special interests are usually connected to politicians. Now, if you look at this, we are really in a very difficult predicament. But at the moment, you may say that there's nothing left to do, but there is always still some solutions. But the priority now, if you look at all indicators of poverty that are rising in Lebanon, the main cause now is the destruction of the purchasing power and the devaluation of the Lebanese pound. So if we still have some resources left, and we do, some reserves left, now the priority should be to abandon all kinds of subsidies, to lift all price ceilings in the economy, and to do only one thing, which is defend the Lebanese currency. And the starting point of that is to first unify the black market rate and the official rate, float it, and defend it. And that's basically the best way to help the poor in Lebanon at the moment. Thank you.
You're muted, James.
I'm mute. Thank you very much, Walid. That's terrific. That's a wonderful start to our talk. And could I just add that from the political perspective, some of you, of course, very well aware of this, but others may be wondering why this situation has been allowed to develop for so long. And the answer is that the actual people in charge in Lebanon, who are not entirely the government is often just the facade, in fact, for far more powerful forces controlling the interests of the country. And these forces are simply not interested in the kind of reform program which is so obvious and for which many good formulae have been put forward, including the very simple and powerful one that Walid has just put forward about defending the currency as a realistic rate. Why do the political powers not wish to reform? In my view, it's because they're continuing to make a lot of money out of the present corrupt system. And they, even with the country going into severe economic decline, they're still making money. And it's not simply personal gain. There's a lot of personal gain, of course. That's the main motivating factor for these people. But there are state interests involved as well. Syria is in an even worse state than Lebanon and has been for a long time in terms of currency and fuel and essentials of life, including medicines. And Syria does look to Lebanon to provide itself with things which actually the Lebanese need. And the Lebanese central bank has been subsidizing. So there's a lot of smuggling into Syria. It's not, Lebanon isn't just an island on its own, as it were. It's got a very needy neighbor next door. So there are geopolitical factors at work, as you well know, and there's this inertia from the point of view of the political class, if you like, who are quite happy with the situation as it is. That is, for a time, we all felt that surely the situation is so bad that a new reform government must be formed and people must get on with real solutions. But we've just seen the resignation, if you like, from the position of being nominated as Prime Minister of Saad Hariri, who has for 9 months been trying to form a government but has been obstructed at every turn. His reasons for not being able to continue is that he wants to form a genuine reform government, and he's not being allowed to, not even being allowed to form the most basically effective sort of government. So we are in a very difficult position. The government is still impotent. It still cannot undertake the radical measures needed, above all on the economic front, to deal with the crisis. So, with apologies for that rather long political interlude, could I now turn to our next speaker, Dr. Ali Fakir, who will, I hope, also speak to us about the economic situation and what we can do about it. Thank you.
Thank you so much, James, for this invitation to talk in this panel. So basically, we'll continue with the same idea, but I want to go briefly over the last 15 years because people believe that things happen suddenly. So let me start with the very, very briefly key features of the crisis. So currency collapse by more than 95%. This is one. Leading to a high level of prices threatening hyperinflation. Coupled three with implicit capital control. So politicians were arguing we don't have capital control, but it was applied since the beginning of the revolution. All these three main factors led to the current shortage in medication, oil, and like Walid mentioned, the wrong use of subsidizing goods and services. It was very bad policy. So the question, if someone would like to ask, what next? So really, the economic situation is too dark. So we have to be totally frank and honest. So this is based on multiple economic facts, so one cannot ignore. But people should understand, and policymakers and everyone in the country and international community, that this is not happen suddenly. So it's important to emphasize that Lebanon economic crisis didn't happen overnight. Looking into some key factors and key observations over the last 3 decades, or if you want, over the last 15 or 20 years. So basically, one, you are observing that the country, all the system, were supporting largely the imports, right? So we want to import a lot, we don't export. So this is led to a huge deficit in current account, and we don't have enough money, and we want to live above our means. So Lebanon has one of the largest debt burden in the world. So this was a common fact for all policymakers across governments over the last 20 years. And when decomposing the system, so basically, it's true, Lebanon was subsidizing import, so allowing us and everyone in the country overall to enjoy lifestyle above of our means. But at the same time, this was coupled with a high connection between politicians, banking sector, and cartels, right? Leading to have high interest rate that attracted money from diaspora, ignoring investment and private sector opportunities and so on. So banks usually prefer over the last 3 decades after the civil war to lend the government in order to get profit instead of financing innovative firms and enhancing the capacity of the private sector. All this happened with the agreement, implicit or explicit agreement of the system, and this was consistent across all government after the civil war. So to sum up this system, so the country was, or the economic system was operating under unproductive rentier economy, revolving around banking sector, real estate, which creates as a result high level of income inequality. We don't want to go into details about income inequalities, but a lot of indicators from World Bank reports and World Inequality Lab shows that the country was not doing great in terms of socioeconomic composition. So around 1% of rich people, they control the more than 25% of national income. Top 10% of rich people, they have more than 55%. So making Lebanon one of the worst countries with high level of income inequality. So this is overall what we had. So this is a fact, and this definitely policymakers may or may not know that we may end up by having some issues, and they tried over time to get some extra funds, some loans from international community in order to delay the collapse. But economic indicators were not doing well. Even before the Syrian crisis and the influx of Syrian refugees before 2010. So the debate tends to blame refugees on our economic problems and issues, but this is not the case. So when analyzing the macroeconomic indicators between 1990 and 2010 on the eve of the Syrian crisis, so economic indicators were not doing, were not so good. So I don't want to spend a lot of time here. So what next? Can we solve this issue? Definitely, always we have solutions, but we have to admit who will initiate the reform. So like Walid mentioned, really we have to stop the inflation in order to save poor and not to worsen the situation. So stopping printing the lira, this is really important. So if we keep printing the Lebanese pound, we have to, this in a brief, 2 or 3 short-run actions can be done easily. Stopping printing lira to control inflation, reforming one sector, which is the electricity, that led to more than 40 billion of our loans. So this is really a very urgent matter to see what should be done for electricity sector, where people were buying for public electricity and for private generators and so on. So someone should be proposing something, but the problem, and the third, before what could be the problem, a third easy short run is to go through tax system to monitor tax distribution. So financial institutions were not contributing a lot, while the burden of indirect tax, such as VAT, were increasing, but on so household were contributing a lot. So these are three short-run initiatives can be done, but you have to admit who will initiate, right? So frankly speaking, the main issue goes back to political system, to the weak institutions that encourages the culture of corruption, of clientelism, wasting public resources. So it's all about institution, right? So after 30 years of managing a company where managers were not able to lead to profitability, so someone should take the lead. Otherwise, the manager will continue with the same process, with the same issue, and you will end up by having the same waste. So I strongly believe that institutions, but this may be, I don't know, in parallel, should take place in order to manage the next step and to initiate these plans. And finally, the public sector. So the size of public sector, really, it's catastrophic, right? So most of waste and the source behind the emergence of clientelism when looking into public sector is the public sector itself. So we all remember in 2018, what happened on the eve of election with the increase of the salary of public servants that led, it was the main issue that led to inflate spendings of government and led to the among the main issues of the current economic situations. I strongly believe, and evidence from research shows that institutions, reforms at institutional level in order to enhance the rule of law and the quality of institutions should take place before or in parallel. I don't know what could be the best format for the new deal, the new social contract in the Lebanon. Otherwise, we'll turn around with the same idea. So the waste will remain the same. So solutions, the situation is extremely dark to end up. Everyone admits it's well known to us as Lebanese, to international community, to everyone. But solutions always exist, and some short-run actions can be easily done. But who will take the action? Thank you.
Thank you very much. Thank you very much, Dr. Adefati. It was most interesting, and I look forward to in the discussion. I hope, by the way, that our audience will be sending in their comments and questions on the chat to Adam, so we can feed into the discussion when it begins. I hope we'll come back to many of the questions you raised, Ali. I think it's worth perhaps me mentioning that the possibility of raising money from outside sources, IMF, whatever, European Union, USAID or whatever, World Bank, these are simply not on the table. The external lenders have said they're not going to lend anything until there's proper, consistent, thorough reform, credible reform, and we're nowhere near that. That hasn't even begun to happen. So one of the questions I'd like to come back to when we do the discussion with the two economists is how does Lebanon survive at the moment, not being able to have access to any external credit and with its own financial situation in debt to itself, if you like. So we'll come back to that later. Could I now ask Firas Abiad to speak to us from the perspective of the public health aspects and give us an idea of how the crisis is impacting Lebanese society, and not only Lebanese, but all the refugees and others who are living in Lebanon. Thank you.
So thank you for having me. So what is the So, concerning the healthcare situation in Lebanon, let's divide it into several parts. The first one is on the personal level. And what we have seen is that the purchasing power of the patients has gone really down, where at the same time, the expenses of healthcare have gone up. We are talking here about medications, doing diagnostic issues such as labs or x-rays. All of these, as the BDL started withdrawing the subsidies, the prices of all of these services have started going up. At the same time, we have seen a lot of shortages in these, for example, in these medications. And this has led to delayed in the treatment with worsening medical conditions. We are seeing in our laboratories, for example, that the average size of tumors that we used to see before now is going up. For example, breast cancer, the average size of breast masses used to be less than 1 centimeter. Now we're talking about doubling of that, for example. We're also seeing cases coming to the emergency room with decompensated conditions, decompensated to get hold of the medications that are needed to stabilize their conditions. And finally, patients also, their ability to pay out of pocket, which is something needed in the private sector, which, remember, comprises about 80% of the healthcare sector in Lebanon. Also, the patients are not being able to pay the requested amounts. And this is leading to a run on the public hospitals. We have seen the cases we've seen in our A&E almost double in the past few months, for example. So how are hospitals faring? Now, hospitals are not doing better, and they are facing many challenges. One of the most important challenges that we can see in hospitals is their human resources, where because of the financial situation, a lot of the doctors and nurses are leaving in droves. They are looking for better living conditions. And remember that Lebanon enjoyed a lot of well-trained doctors and nurses. So it's not difficult for them to travel abroad and find work elsewhere. Where hospitals are also facing shortages in medications and supplies. And these shortages have been affecting the quality of care and sometimes even putting patient safety at risk. For example, recently, we've had a severe shortage in medications used for anesthesia or for pain medicines. And these are important in our critical care units, which were filled with patients having COVID. In addition, recently we've started having shortages in electricity, fuel, and latest thing we'll start seeing is shortages in water. Why? Because of, initially the hospitals were not included in the severe power cuts that are now normal in the country. For example, a hospital like Rafiq Hariri, the largest public hospital in Lebanon, we used to have 2 hours of power cuts per day. Now, sometimes we're subjected to 21 hours of power cuts. And even if we could get our hands on fuel, which is difficult, we have to pay for that now at market level, which also is increasing our expenses. Unfortunately, the patients that we are receiving are impoverished, and a lot of them cannot afford to pay the difference in expenses between what is a stagnant tariffs, because the Ministry of Health, which is the largest guarantor for patients coming to, for example, public hospitals, have not changed its tariffs for years. And despite the increase in the expenses, the government is still providing us with delayed payments, putting our operations at risk. And recently, we've had 2 public hospitals that have stopped working, and they're now just limited to life-saving operations. Interestingly, one of them, Sibleen, used to be, from a financial point of view, one of the best public hospitals in the country. It used to run with a surplus in its budget, and now they ran out of money and they had to cut their services. Now, all of this is coming with the backdrop of COVID. Now, initially, Lebanon had a very good COVID response. The government was very quick in implementing a curfew. Now, some cynical people might say that is because they wanted to get people off the street. But irrespective, The result of the early curfew that was implemented was a low number of cases. However, the policies that the government or the strategy, if there is a strategy, it tends to be very short-term. And therefore, they resulted to opening the country last end of spring last summer, and that initiated a wave. This was repeated again in the New Year's and Christmas holidays. And then we had a major COVID wave in the country, resulting in thousands of deaths. And hospitals were on the brink. They were filled almost to very high capacities. Some of them were at 100% capacity. Unfortunately, although the numbers then improved of COVID patients, and they were brought down tremendously after a very severe curfew, now hospitals find that they are very ill prepared. And with the Delta variant now coming to the country, we are seeing a resurgence of COVID. We are seeing the numbers are starting to go up. This is in the number of cases, number of test positivity, and also a number of hospitalization. Vaccines will not save us simply because the percentage of the population that has received double dose or full vaccination is still about 15% according to the MOPH, if you consider only vaccination in the targeted population. But if you look at vaccination in the overall population, it's about full vaccination, 60% vaccination, are seeing very large COVID numbers. In Lebanon, we have dropped all measures and increased a large increase.
Could I just ask you to go back
Yes.
the last minute, because there was a little bit of problem on the line. You were telling us the statistics for the vaccination rates, and you said 15% for the targeted population.
Yes. So we are at
that. We lost you a bit. Thank you.
So it's 15% for the targeted population, but for the overall population, the full vaccination stands at 10% at the moment. And the main challenge really is that we don't have enough vaccines. Getting the number of vaccines that we need to drive this up. So considering that
I'm sorry, we're
better
just
vaccination rates have been, then this doesn't bode well for the now. So what needs to have focus on the? So sorry for if there's any problem with the connection. So let me end by what needs to happen. I think that at the moment, we can only focus on the very short term. We need to stop the hemorrhage, so to speak, because really the hospitals are in a very difficult conditions. And we are seeing that the healthcare conditions overall are worsening. How do we do that? First, we need to attend to the hospitals and make sure that they are better equipped, which is something at the moment that is not happening. We also need to get our hands on more vaccines. Hopefully that will help us keep the numbers low, although whether they will arrive on time or not, this is something that I am not sure. Finally, medications is going to be something that's very important. We do have a very weak PHC primary healthcare network in Lebanon, but through this network, we can also try to get medications to the needy people should the steps in raising and eliminating the subsidies that we are witnessing continue. Thank you.
It's James, you're muted. Sorry. You're muted, James.
sorry.
You're muted again.
There we are. Sorry. Thank you very much, Firas, for that. Thank you, Fuad, for that most interesting talk, Firas. And we'll come back to several of those points, I'm sure, in the discussion. Could I just ask, Fuad, if you would kindly talk to us a little bit about the situation of the refugees in Lebanon from the public health perspective?
Well, thank you, James. Thanks a lot, and thank you for the organizers for inviting me. This is a privilege, and also to say I enjoyed listening to. I mean, I'm lucky enough to listen to Walid and Ali, Firas, about setting not just the scene but criticizing deeply the current situation from the economic perspective and from the public health. But also, to be honest, I think James added something very important that I wish maybe during the discussion to have it more is about the political issue, which is cannot in Lebanon, ignore this major factor that affect economy and other, social aspects, including education, health, and so on. And that could be, an entry point to my intervention and about refugees. Though we discuss a lot about that, there's a need to have more integration when thinking about the refugee crisis in Lebanon. But it seems even in this panel, we have refugee as a separate issue, which is, I'm fine with that as to have it from the technical issue, but maybe we can see a refugee crisis, not just in Lebanon, but in the entire region, is not separate actually from other problems and mainly from the political lens. Just let me start with some or a few numbers. So for the 1 million, almost 1 million Syrian refugees in Lebanon now. I mean, the registered refugees is less than, it's 800,000 at UNHCR, but we know that since 2015, UNHCR stopped registering Syrian refugees as per request of the government. So the number could be something around 1 million more or less. But we know that there are 270,000 Palestinians and almost 15,000 domestic workers, migrant workers in Lebanon. So for Syrian refugees, 90% of them live in extreme poverty. And this number, according to World Bank and even Wazir report, went up from 55% in 2019. And this is clear because of what Walid Ali mentioned about the collapse of economy. But 90%, when thinking about the Lebanese themselves, 77% now living in this extreme poverty. 50% of Syrian refugee households in Lebanon suffer from food insecurity. Female-headed, actually, households are more food insecure in Lebanon than male-headed, households. As for COVID, as Dr. Firas Abiad mentioned that, so we know from Minister of Health and the bulletin of WHO that out of 1.6 million vaccine doses that administered in Lebanon, only 22,000 went to Syrian refugees, which is equal to 1.6%. And this is a quite important number because if we think about the registered Syrian refugees in the platform, it's the same percentage, almost like 1.4 registered on the platform. So what could be the reason for having this sort of low percentage of vaccination and registration at the same time? The main issue could be, I mean, there's no study enough, but the main issue could be, this sort of lack of access to information, which is clear, lack of a legal status, as we know also that now 85% of Syrian refugees in Lebanon lack legal residency. This is because that, as mentioned, they didn't register at UNHCR or not allowed to register now. They have to pay $200 a year to register at General Security. they have to have a sponsor, a Lebanese sponsor, and they have to have the approval from the General Security. So that, made the number drop from 15% in 2013-14, those who are legally live in Syrian refugees living legally in Lebanon, to now 85%. This sort of lack of legality affect their mobility in Lebanon, and that affect their health access. Though they have access to primary care, but since the beginning there's a problem of access to secondary and tertiary care that costs them a lot. When we know that only 75% of the subsidies come from the UNHCR and other organizations, so the rest 25% is very high for Syrian refugees. Actually, it's high even for the Lebanese themselves. So when talking about health access, the issue of legality, the issue of lack of information are two important factors to do that. And these issues are not purely economic issue or educational issue or cultural issue. This is mainly a political issue, because not registering at UNHCR is by the government itself. Not integrating in the system is something as a sort of as an outcome from the political, let's say, crisis in Lebanon. So what happened? What are the coping mechanisms that Syrian refugees did to meet, this issue of difficulties and challenge? It's clear in the last few months, after this multi-crises happened together, that we see increase in child marriage. We see increase in child labor. We see that families, according to WFP, that reduce the number of meals daily and the portion of meals. So they're reducing that to the minimal. And of course, we saw that this is, withdrawing children, from schools to fuel the child labor. And the last phenomenon that we start seeing, very, very obvious in the city is the begging. So you see that many now, Syrians in Hamra and other cities, other streets in the city that affect their daily life. So another number that while thinking about this webinar is the increased death rate among Palestinian and Syrian refugees affected by COVID, comparing with the Lebanese counterpart. So almost 4 times Syrian and Palestinian die because of COVID, comparing to the Lebanese. And that clearly reflects the issue of access to hospitalization and tertiary care. Before stop here, and in a way to try to respond to this question, what is next? I think, unfortunately, the question about next in Lebanon is something cannot be disconnected from the last or past. I mean, this is sort of a continuous crisis that in the last at least 2-3 decades that accumulate by time, and so cannot think about next without thinking about all these problems in the past to address that. One of them related to Syrian refugees themselves is the issue of how now to bring this question back about integration. And I know that this is very sensitive, but integration, I mean here, is about how that could be in the system. It's not about citizenship, but how the Syrian refugees can be engaged in the system, to be part of, the entire system, and not to have a parallel or separate system under what's called now the humanitarian system. Though, according to economists, now one of the main sources of the foreign currency to Lebanon is the money that comes to under the humanitarian aid. Overall, this should be anyway part of the integrated solution and not separate one. I'll stop here and thank you very much for giving the opportunity.
Thank you very much indeed, Fouad. That's most interesting, some fascinating and very depressing figures there. And I think it's important to remember that the Syrian and Palestinian and other refugee populations in Lebanon have got an additional layer of human suffering to cope with compared to the Lebanese. And it is encouraging that there are humanitarian funds still available to them and also to the poorer Lebanese. And that is, as you say, a source of foreign currency, amongst other things. But I think it's been a fascinating discussion so far. We've got a little bit more time to go, and I'd like to start the discussion. We've had a question, a very good question, which simply says, how does this end? In other words, where does it go and how does it end? And I think that's been actually partly commented on by Fouad just now, said we must see this as a continuous crisis. We are in a continuum. There's no sudden change to politics or whatever, which is going to give us the magic solution. But there are plenty of perfectly good political and policy solutions out there, which experts, including those of you speaking here today, have indicated. What is lacking, of course, is the political will. And I'd like to ask each of our panelists, perhaps starting with our two economists, to say, what's actually going to happen? What's the worst case scenario? Are we going to run out of foreign currency? Is the central bank going to finally give up trying to do anything? What are the sources of income, fiscal income at the moment? How can this keep going without further distorting and destroying the economy? And of course, without relying on external borrowing, because that simply isn't available. Could I start with the two economists? Could I start with you, Walid, perhaps, to comment on that?
Yeah, sure. My fear is the following. I think we have a little bit less than $15 billion in required reserves now at the central bank. And I fear that the Lebanese politicians will keep pressuring the central bank to spend these resources on these silly subsidies. And once we run out of these reserves, the Lebanese pound will be not covered anymore by anything, because anyway, already the trust in the central bank is destroyed. So we still have these reserves. And at that point in time, the Lebanese pound will be worthless. It will lose all its function as currency. It already lost some of its function. We know that a currency has several functions: a medium of exchange, unit of accounting, and store of value. So the only thing that is left now for the Lebanese pound is being used as medium of exchange. But if it keeps on depreciating, it's already depreciated more than 90% of its value. At some point in time, it may no longer be used as a currency in Lebanon. And we have evidence that many merchants are already demanding payments in banknotes, in US dollar banknotes instead of Lebanese pounds. Unfortunately, this means that the economy going forward will be much smaller and much poorer. Another thing you mentioned about way outs, right? So what can be done? I think now, if we don't have any political solution over the short run, Lebanon is in dire need of urgent humanitarian aid. Lebanon, like Yemen, we may need fuel aid, we may need wheat and medication. So, and this cannot wait. As you know, if it's a humanitarian crisis, Fouad talked about it, and this cannot wait for these political reforms to come. We know, like, if we want to have an IMF program in Lebanon, this requires formation of a government and negotiations. This will take at least a year. We cannot wait. We don't have the luxury to wait, and especially that the elections, if they're coming in 2022, it's too far. The Lebanese are suffering on a daily basis. It's too far to wait a year. It might get worse, unfortunately.
Yes, and I don't think the elections are going to be a solution to anything, because they're very likely just to perpetuate the same corrupt system.
Yeah, most likely, yeah.
Was. Ali, would you like to comment also from an economic perspective?
Yeah, so really it's what to say. The economic situation or the situation is really open to any possibility. So we may have worse scenario, like what did mention and describe the situation. So the devaluation can continue, and we may end up by having zero fuel, zero basic goods in the country. So as long we don't have a political will to start to with some solutions and to admit the fact and the economic facts that we are suffering, we are in a misery, so nothing will happen. Like you mentioned, so all issues are now connected. So we have election in May, if the election will happen, and in October we have presidential election. So in the mind of politicians, so they are trying to plan and to connect all these issues to when the best timing from their perspective and the optimal timing to start subsidizing fuel. So all these scenarios will lead us to strongly believe that the worst may come very soon in September, in October. I don't know how things will be accelerating, but really there should be a political will to start with the small things. Otherwise, a new government will not do anything. A new election in May will not change anything. If we don't change the current situation of institutions that they are weak, fragile, and
yes. No, I think we can see that.
Yeah.
That's very good. I mean, if the currency loses all its value, which is a scenario that Walid sketched out, then the public sector, for a start, cannot be paid. So the politicians will no longer have the power of patronage to employ people in the public sector, for what that's worth. And I think it is a formula for huge social upheaval and angry protests. But perhaps I could go over to the medical, public health side of the team. And Firas, how does it look from you? What's the worst that could happen and the best that could happen in practical terms?
It's muted, Firas.
Walid, sorry, sorry, not Walid.
Firas,
I wanted to. Yes.
So I think that the worst that could happen is the COVID, because unfortunately, COVID is working as a catalyst to the healthcare crisis. Mm-hmm. And what we are seeing now, especially with the very pervasive attitude of the population, the COVID numbers will be rising. At the same time, all viruses fare better in winter and the autumn, and therefore we probably are going to hit our stride in sometime during September, October. At the same time, the hospitals are, the conditions are deteriorating. And whatever reserve a lot of those hospitals have had has been consumed. And unless we get immediate and really, large volume of humanitarian aid to the hospitals, then I think that we are looking at a car. I believe the healthcare sector, because of the epidemic and other sectors, although everybody is in the worst of shapes.
Thank you very much indeed. It's quite a depressing story forward. Would you like to comment?
Yeah. Strangely, that according to Brookings Institute, talking about Syrian refugees to Syria, according to their survey, very few want to go back, and every Syrian understands why, because of the issue of fear, because of the issue of military services, because of the issue of also the severe economic collapse. So very few want to go back. So if the return is almost impossible or very difficult, and if by now 90% under, the poverty, the extreme poverty, And if there is no future because people cannot go out, there's no resettlement. So you can imagine that we have 1 million that will suffer from very, very dire situation conditions. And to link that with this is the economic, social issue, but to link that with health, if we agreed about, that the correct of this number, talking about only 1.6 are vaccinated. So as Dr. Firas mentioned, that the potential group of population that could affect with this increase in the next pandemic wave will be, the Syrian refugees. And that, though there are some protective factors to say about it, but if that happened, that would be a big health crisis. But regardless of, the COVID itself, all other indicators, health indicators, are difficult for Syrian refugees. And health cannot be separate definitely from the economic, nor from the political issue. So what could be the worst scenario? I mean, I even cannot imagine how worse that will be if we consider, this is the worst economic crisis in the region. And and also it is the most difficult or worst refugee crisis in the region since the Second World War. So what does it mean to have these both overlapped crises on the group of population?
And the worst pandemic was,
sorry?
And the worst pandemic since 1918.
And worst pandemic. So you can imagine this will be apocalyptic, situation, unless there should be some sort of, maybe now what we need is regional international movement. This shouldn't be led to the politicians in this region.
Thank you very much. That's, I'm just going to look to see if there's any more questions. Right, there's a good question here. What is the international community's role in helping Lebanon? And how do international actors intend to bypass the corrupt governing system? Well, that's a very good question. Could I start by answering that? The international community has been providing humanitarian aid really since 2011 to Lebanon and to the Syrian refugees coming into Lebanon, and indeed providing it more widely. And of course, Yemen has been a very important example of a country in great need of that aid. I think a lot of donor fatigue set in quite a while ago, quite a few years ago, and that was before we got to the present crisis. The present crisis in Lebanon entirely avoidable by its politicians, and it's been made very clear to the politicians that they have got to sort it out. They've got to sort out their own way of stopping misgoverning and actually governing in a rational and disinterested way. Instead of, as we've heard, they're still playing games about exactly when to play whatever benefits they can for their re-election next year. So I think there's donor exhaustion, not just for Lebanon, but for the other regional situations. The COVID pandemic has certainly resulted in the West becoming more obsessed with itself, or rather less generous, as we've seen in the very unfortunate decision by the British government to reduce its overseas aid budget allocation, which has directly impacted situations such as the humanitarian needs in Lebanon and Syria. So it is not looking good. The international community, I don't think, is going to change its stand very much on that, partly because it's got still huge demands on it in terms of humanitarian assistance from countries which need help with vaccinations. And that is going very slowly, as you know, far too slowly. And clearly, Lebanon and the Syrian refugee population in Lebanon should be high on the list for priority vaccinations. That's all taking a long time to develop. So I'm not very hopeful on that. But I just wondered if, before we conclude, I think we've got another 2 or 3 minutes perhaps before we'll close the session, but if any of our commentators, any of our panelists would like to comment on that, and particularly the aspect of what could the international community be doing, and what is it already doing? I mean, to what extent are you receiving, in public health, for example, are you receiving assistance from international donors?
Yeah, so at Rafiq Hariri, we've actually had a very good model of partnership with international actors. The one that is the best is the one we have with the International Committee of the Red Cross. They are present with us in the hospital, and we do many projects together. This has allowed us to better focus the international aid that is coming, and to be honest, it's for it to be properly used. I think what is something that is we are all in agreement is that money should not be thrown. And I don't think the international community anyway is into doing that. I think that it's especially to avoid corruption, to avoid losing a lot of the value of that money, is that this model where actually we are joint in doing those projects has better utilization and ensures that that money is being well spent.
Can I contribute a bit, James? Just a few, because I also try to answer Richard Sullivan's question here also. I think, as Dr. Firas mentioned, Lebanon has a legacy of, being connected with the international actors, donors. It's not new. They know how to do that. They know, there's a sort of a huge Lebanese diaspora since decades, outside. Lebanon is a small country, with 5-6 million, and I think for me, when thinking from the political perspective and economic one, I think it's easy to tackle that, with a few billions, it's not that miracle to tackle all these problems with this experience about how to have this connection with international actors. The only key issue is to have this political will. And without having this political will, nothing will open. No one will help. No one will. So this is the key secret word. Without having that, so that will be impossible. Back to the question of Richard about this, how this system can, or healthcare can be addressed. I think again, with the same experience of Lebanese, health workers, with the same infrastructure, with the same huge connections with the Lebanese doctor diaspora, I think also it's easy to tackle that if again and again this sort of willing will be available, for the Lebanese themselves.
Thank you very much.
Walid, I took your
no, that's very useful. Could I just very brief last words? Yes, Walid.
Yeah, just concerning like the two questions about what can be done, because we are in a vicious circle. So if they're not going to reform, they're not going to receive aid. There is no aid. There is no solution. So at least if the politicians are not able to do anything to reform, maybe they should not do something, which is they are doing now, which is bad. For example, the price ceilings that are causing the shortages. This is something that can be not done, just not do it. And at least it will solve partially the shortage problem. Even now, if charities, they want to donate fuel and medicine, they cannot, because they cannot find the products on the market. So if you cannot do anything, if you are a loser, you are not able to do anything, at least just remove the price ceilings. Let the market work. Let the market work. Give it a chance. It's not going to be good for everyone, especially the poor, but at least the products will be available, and then they will adjust somewhat.
Yeah. Thank you very much. Adi.
Yeah, James, very quickly also to follow up on the questions raised by Sharif. So basically, yes, just let more companies to import medications, for example, right? So as long you import more, so you may increase the competition, prices may be reduced, and the product may be available. It may need some time, but this is really straightforward and easy to do. Yeah. To reduce and to constrain the presence of cartel in medication sector. This is really easy. Thank you.
Thank you very much, all of you. Could I thank all our panelists and just try to sum up briefly on this concluding note, which is, thank goodness, a little bit more hopeful. Which is that Lebanon does have great inherent skills, a highly educated population, extremely well connected internationally, a strong and wealthy diaspora. a functioning foreign aid system, humanitarian aid system, partly through charities and with people like the Red Cross, the International Red Cross, which is working, which does make a difference. It's not the whole answer. There are policy solutions which can be applied quickly, including the do no harm maxim, which, you know, stop imposing things like these, the price ceilings which are doing such harm. There are ways forward. And the only depressing thing is that they've yet again not been taken, with the final refusal of President Aoun to allow Saad Hariri to form the government that he thought was needed for this. So we have that setback, but at the same time, we have those positives still in hand. And I personally believe in the future of Lebanon. I think as Walid says, it's a smallish country. It doesn't actually cost so many billions to put it back on track. It's not like we were trying to aid some extremely populous country. Lebanon does have a lot going for it, but the situation is grave. And as we've seen in the earlier part of the discussion, it could get much worse and relatively soon. But let's hope it doesn't. But thank you all very much indeed. On behalf of Research for Health and Conflict, Middle East and North Africa, a program led by King's College London, I'd like to thank all our audience as well for attending and for listening in, for your questions. We hope to see you on other occasions. Thank you all very much.
Thank you. Thank you.
Thank you, James.
Thank you.
Thank you all.
James. Thank you, everyone.
Thank you. Bye-bye.
Bye-bye.
Bye.